Let's take a look at the ultrastructure of these different types of capillaries. In a continuous capillary, you can see the tight junctions that bind each of the endothelial cells to one another, and because of this, the cells perform a lot of transcytosis using pinocytic vesicles. So you're going to see a lot of pinocytic vesicles in the cytoplasm of these cells. So where do you find them? In muscle, in the lung, in the central nervous system, all good places to find continuous capillaries. Fenestrated capillaries often have these diaphragms covering the fenestrations, as you can see in this example. They also contain a lot of pinocytic vesicles, and you can find them in endocrine glands and GI tracts. Discontinuous or sinusoidal capillaries, first of all, have a very large diameter lumen and can often be irregularly shaped in comparison to the other types of capillaries, which are usually more round. They do have those actual spaces between the endothelial cells, as you can see in the image on the right, and they have an incomplete basal lamina. All of these features, the large diameter, slows down the blood flow, the spaces between endothelial cells and the areas with incomplete basal lamina allow for a lot of open exchange between what's inside the sinusoid and what the underlying cell population is in contact with. And this is found in places such as the spleen and the liver and the bone marrow. Structures called arteriovenous anastomoses act as shunts to control the blood flow in certain areas, such as the areas in the dermis. When you want to conserve heat, blood can be shunted away from the capillary bed in some cases and directly into the venous circulation using these arteriovenous anastomoses. This happens because the arterioles, well, special areas of the arterioles called meta-arterioles, have precapillary sphincters of smooth muscle that can be essentially activated and shut off the blood flow into those capillary beds and send it in through the arteriovenous anastomosis and then straight into the venous circulation. The venous side of the circulation differs in several ways from the arterial side. If you have a vein and an artery side by side, there's some clear differences between them. In general, veins have larger lumens, thinner walls overall, and oftentimes the lumens can be irregularly shaped or appear to be collapsed. So in this diagram below, you can see the overall thickness of the arterial wall is much greater than the overall thickness of the venous wall, and the lumen is a bit more irregular, almost angular appearing in the vein, but more ovoid in the artery. And that's a typical appearance. So the smallest elements of the venous circulation are the venules. So as soon as you leave that microvasculature of the capillaries, you enter what's called the postcapillary venules. Now, these structurally are pretty much indistinguishable from a lot of the capillaries, and I will not ask you to distinguish them histologically or ultrastructurally from one another. These postcapillary venules receive the blood directly from the capillary bed, and at this point the pressure is quite low and the circulation is slow, and this is the place where extravasation of cells, in other words, the place where cells adhere to the walls and get out into the underlying tissue compartments. So that's the site where that occurs in postcapillary venules. It's also the site for the action of histamine and serotonin. So what do these things look like? Well, they have a lumen that's slightly larger than the typical capillary, maybe 10 to 15 micrometers. And like a capillary, they have a simple endothelial tube, basically just a tunica intima. Occasionally, like some capillaries, they may have a pericyte. You can see one here, but they never have any smooth muscle. So You might ask yourself, how could I possibly distinguish this from a capillary? And it's pretty darn tough. Usually by the extravasation of cells happening there would be how I would do it. So as you go further along the system, you get to venules that are somewhat larger in diameter. These can feature a lumen up to 100 micrometers, but still the wall is very thin. In other words, it's just still a thin endothelial tube with no smooth muscle lining it. And there's a couple of nice examples here. So if you have something that has blood cells in it and you can't see any smooth muscle, it's most likely a venule. Small to medium veins can be identified by the presence of at least one or more layers of smooth muscle in their wall. So unlike a venule, they have a tunica intima like the venule, but then they also have elements in the tunica media. Compared to arteries of the same size, they will have a thin tunica media and a very thick tunica adventitia. So whereas an artery of the same size would have a bigger media and a smaller adventitia, these ones, the adventitia is really the thickest layer and has the most different cells and elements in it. So you might see a variety of connective tissue cells out there in the tunica adventitia. And if it was stained for elastic stain, you might see some elastic fibers as well as collagenous connective tissue. Small to medium veins feature a luminal diameter of up to 10 millimeters. The tunica media has some smooth muscle and, of course, elastic and collagen fibers. And also you find the same elements like elastin and collagen in the tunica adventitia. And as I said before, it's thicker than the media in these veins. The largest veins, such as the vena cava, have very distinctive features. So let's start next to the lumen, looking at the tunica intima. Like the largest arterioles, they have a thicker tunica intima than most other vessels. They also may have a distinct internal elastic lamina. They have a tunica media with, usually up to about 10 to 20 layers of smooth muscle. However, their thickest layer and most distinctive layer is again the tunica adventitia, which characteristically has longitudinal bundles of smooth muscle. So it's that feature of those longitudinal bundles of smooth muscle in the adventitia that helps define these large veins as a subtype. So some examples of large veins include the subclavian, the portal vein, as well as the vena cava that I already mentioned. And the features are listed here, and I already did discuss them. So here is an actual image of the vena cava at low magnification, and although at this magnification you can't really see any of the features of the tunica intima, you can see how large and thick that tunica adventitia is. Let's look medium magnification. Here you can see the endothelial cells right at the edge lining the tunica intima, lining the vessel, and underneath that you can see the wavy pink line of the internal elastic lamina. There's some subendothelial connective tissue there as well, and then directly under that you can see the circumferential layers of smooth muscle in the tunica media. At the top of the screen you can see the dark pink bundles of smooth muscle here that are in the adventitia, and those are the longitudinally oriented ones. We could take a look at those at a little bit higher magnification, and you can also see in the adventitia examples of vasa vasorum.